may have seen this Friday when the American Heart Association and Go Red for Women rang the opening bell on Wall Street, ushering in February as Heart Health Month. It's part of a campaign called Go Red, Shop with Heart, designed for retail partners to bring attention to heart disease and stroke. KTBS3 is partnering with Christus Health to mark Heart Health Month, and for one Shreveport woman, it's a health crisis she never imagined would hit her. KTBS3 Shannon Brenius reports.
Susan Hall's love of travel and grandkids gave her much to look forward to in her golden years after decades as a nurse and health administrator focused on oncology.
It was great. The nurses have such an informal support system that they are a great team.
With her professional focus on cancer, Hall might have fallen into the trap personally of not realizing heart disease is a much greater risk for women, killing more women than all types of cancer combined. That leads many to downplay warning signs. For Hall, increasing shortness of breath and fatigue would be the only noticeable symptoms in 2023 to lead to a potentially fatal diagnosis of heart blockages.
I had an aortic valve that was about half the size it should have been. My aorta had shrunk down, and I'd begun to grow tissue in my ventricle.
Yet women continue to be grossly underrepresented in heart disease and stroke research, leading many women to downplay warning signs.
I think the day in his office really was an eye-opener for me. He told me that I had a 50% chance of still being alive in 2 years. And I had grandchildren. You know, I had just retired. I had a lot to do.
Hall had made lifestyle changes, enough for her to lose 40 pounds and become much more active. Still, it wasn't enough to stave off the need for a serious operation.
It's a full open chest. I was on the heart-lung machine. It took about 7 hours.
Post-operation, there were long days in the hospital and working at cardiac therapy. The aim is better cardiac health for Hall, and now awareness for others who have all too much to live for.
It took time. And if I were to talk to anybody that was facing this, I would say, just give yourself some grace.